Hi guys, welcome to the video. So I'm going to give some commentary on Boris Johnson's latest video regarding the current situation of the lockdown. So I'll leave a link to the original video in the description if you don't want to listen to my comments. But let's see what he has to say.
It is now almost 2 months since the people of this country began to put up with restrictions on their freedom, your freedom, of a kind that we have never seen before in peace or war. And you have shown the good sense to support those rules overwhelmingly. You've put up with all the hardships of that program of social distancing because you understand that as things stand, and as the experience of every other country has shown, it's the only way to defeat the coronavirus, the most vicious threat this country has faced in my lifetime. And though the death toll has been tragic and the suffering immense, and though we grieve for all those we have lost, it is a fact that by adopting those measures we prevented this country from being engulfed by what could have been a catastrophe in which the reasonable worst case scenario was 500,000 fatalities.
So he continually uses this 500,000 fatalities and ignores the actual current rate. And I think this is not being honest, because he should actually talk about how many people who have actually died and not just talk about how many people who could have died. The number he's talking about who could have died would be if there were no social distancing measures in place and there was no lockdown in place. Now, I don't think there was ever going to be a case of the UK not going into lockdown. But I think it's important also to talk about how many people who have died, instead of just repeating the fact that, or the possibility that 500,000 could have died.
And it's thanks to your effort and sacrifice in stopping the spread of this disease that the death rate is coming down and hospital admissions are coming down. And thanks to you, we've protected our NHS and saved many thousands of lives. And
so once again, he's putting the onus on the people. The reason the NHS was protected because you did your job. He's not talking about the government doing their job. This is always, you have to do your job as a citizen. You have to protect the NHS. Not we as the government have to protect the NHS. But in reality, it's your job, Boris, to protect the NHS, in the sense that you have to create laws for social distancing, you have to create rules for people regarding their jobs, and you are doing some of these things. But of course also the NHS need money, they need resources, they need PPE, they need staff. And some of these things they haven't received, or they haven't received enough of.
So I know, you know, that it would be madness now to throw away that achievement by allowing a second spike. We must stay alert. We must continue to control the virus and save lives.
Now, this thing about staying alert, this has created some controversy in the last few hours since this video was released. The message from Downing Street is to stay alert. So they changed it from stay home to stay alert. Now, how are people supposed to stay alert? They can't see the virus. They can't smell it. They can't hear it. They can't really see its effects unless they go into hospital, unless they see loved ones dying from it. You cannot stay alert with this virus. This is not something that you can identify on the street or in your home or in your workplace. Unless he's talking about identifying people who may have symptoms, then I can understand staying alert. But moving from stay home, which is a good policy, it's used in many other countries, stay at home, stay home, whatever. But stay alert, I don't understand what he's implying here.
And yet we must also recognize that this campaign against the virus has come at colossal cost to our way of life. We can see it all around us in the shuttered shops and abandoned businesses and darkened pubs and restaurants. And There are millions of people who are both fearful of this terrible disease and at the same time also fearful of what this long period of enforced inactivity will do to their livelihoods and their mental and physical well-being.
And I understand that. But if we look at a country like South Korea, they were able to avoid the worst of the lockdown. They were able to avoid a lockdown pretty much because they were proactive. They saw the virus was something real. They didn't ignore it. They didn't say it would go away. They didn't say it will not arrive here. It's something that is limited to China. They were proactive. They implemented a track and trace system, checking who was infected and checking who was in contact with those people before they showed up as positive in the checks. This was something that was implemented in South Korea. I'm not blaming Boris in a way for this, but a lot of this lockdown could have been avoided if also us in Europe were more proactive. I hope that we're going to learn from this. So the next time something like this comes along, that immediately we start testing, we start tracing, and then we can avoid having a lockdown.
To their futures and the futures of their children. So I want to provide tonight for you the shape of a plan to address both fears, both to beat the virus and provide the first sketch of a roadmap for reopening society, a sense of the way ahead, and when and how and on what basis we will take the decisions to proceed. I'll be setting out more details in Parliament tomorrow and taking questions from the public in the evening. I've consulted across the political spectrum, across all 4 nations of the UK. And though different parts of the country are experiencing the pandemic at different rates, and though it's right to be flexible in our response, I believe that as Prime Minister of the United Kingdom, Scotland, England, Wales, Northern Ireland, there is a strong resolve to defeat this together.
Okay, and there's the unionist message here. I don't think it's really the place to put it, but I understand you're the Prime Minister of the UK, so you have to promote the union. But there are different ways of dealing with this. And of course, having a different way of controlling the virus in Northern Ireland compared to the Republic of Ireland doesn't make a lot of sense. The Northern Ireland is closer to the Republic of Ireland than it is to the rest of the UK. So it makes more sense to have an all-Ireland approach to the virus. Of course, doing it the UK way means that you're going to have different approaches between Northern Ireland and the Republic of Ireland. But also the case is in Scotland and the rest of the UK, between Scotland and England and Wales. Having a different approach may actually be valuable.
And today, a general consensus on what we could do. And I stress could, because although we have a plan, it is a conditional plan. And since our priority is to protect the public and save lives, we cannot move forward unless we satisfy the 5 tests. We must protect our NHS. We must see sustained falls in the death rate. We must see sustained and considerable falls in the rate of infection. We must sort out our challenges in getting enough PPE to the people who need it. And yes, it's a global problem, but we must fix it.
No, it's to say that it's a global problem is ignoring the fact that you made huge mistakes. Your administration made huge mistakes. The previous Conservative administration made huge mistakes. Please admit it. Say, look, we made mistakes on PPE. Now we're trying to fix it. But just saying it's a global problem, everyone has this problem, is avoiding the fact that you made mistakes. And mistakes until recently. Look at the Panorama program, if you don't believe me, regarding the mistakes that the government made.
And last, we must make sure that any measures we take do not force the reproduction rate of the disease, the R, back up over 1, so that we have the kind of exponential growth we were facing a few weeks ago. And to chart our progress and to avoid going back to square one, we're establishing a new COVID alert system run by a new joint biosecurity centre. And that COVID alert level will be determined primarily by R and the number of coronavirus cases, and in turn, that COVID alert level will tell us how tough we have to be in our social distancing measures. The lower the level, the fewer the measures, the higher the level, the tougher and stricter we will have to be. There will be 5 alert levels. Level 1 means the disease is no longer present in the UK, and level 5 is the most critical, the kind of situation we could have had if the NHS had been overwhelmed.
Now, this is a good plan, but there is an issue I have with it. Now, I think it's a good idea having an alert system. It's a way to convince the public to be careful, not to get complacent. And it's a very simple and easy way for people to understand, okay, there is an alert, there is a crisis at the moment. Without having to go into a lot of detail, you can say we're in orange or we're in yellow, now we're moving into green. But the problem I have with this is that there is a delay. There is a delay of perhaps up to a week. So what I mean by this is, let's say you go from 4 to 3. So the number of new cases, new infections, and the R rate is down, is declining. So you say, okay, let's move from 4 to 3. The problem is that if you make certain changes, you open up the society in this way. You open up some more aspects of society, shops, bars, or whatever. You're not going to see the result of that for about a week. Now, if the result is negative, first of all, if the result is positive, then there's nothing to worry about. But if the result is negative, that means you have lost a week that you have to then increase the alert level. And then you're going to have another week before you can actually see the result of that. So every time you move between one level and the other, every time you increase the availability of services, you reduce the lockdown. You're going to have to wait at least 2 weeks to find out if it was successful or not. And unfortunately, during that time, people are going to die. But I do welcome some type of alert system. I think it's useful for the public.
Over the period of the lockdown, we've been in level 4, and it's thanks to your sacrifice we're now in a position to begin to move in steps to level 3. And as we go, everyone will have a role to play in keeping the R down by staying alert and following the rules.
But it would make more sense convincing people to stay at home more. I understand staying alert, but staying alert to what? I've seen videos of people in the UK today walking around without masks. Why is there no request for people to wear masks? There's no request for people to wear gloves when they go into supermarkets or public places. There should be an emphasis on mask wearing and gloves wearing. This is the science. The science backs that. You've been always talking about following the science, but you're not following the science here.
To keep pushing the number of infections down, there are 2 more things we must do. We must reverse rapidly the awful epidemics in care homes and in the NHS, and though the numbers are coming down sharply now, there is plainly much more to be done.
Yes, because a lot of people are in care homes are dead. I'm sorry to put it this way, but a lot of people have died in care homes. And many care home staff don't have PPE, and they're getting infected as well. You can't say we're going to focus on care homes. Care homes should have been part of the focus from the beginning.
And if we're to control this virus, then we must have a world-beating system for testing potential victims and for tracing their contacts.
But why is this all being done now? You had an opportunity to avail of European Union resources to deal with this crisis, and you ignored that. You rejected it. And now you're saying now we're going to do everything possible.
So that, all told, we're testing literally hundreds of thousands of people every day.
The problem, again, with the testing, you send out tests to people to complete by themselves. This is not following the science either. Scientists will never say, send out tests that need to be done by trained staff, such as nurses or doctors. Send them out to people who have no understanding of how to conduct these tests, and then get them to send back the results. This is not the way to do a test. You need trained staff. They don't have to be surgeons, but they have to be trained to conduct these tests. So sending out lots and lots of tests may sound good for the media, may look good on a spreadsheet, but it's not going to be useful. It's going to be a waste of resources.
We've made fast progress on testing, but there is so much more to do now, and we can. When this began, we hadn't seen this disease before, and we didn't fully understand its effects. With every day, we're getting more and more data. We're shining the light of science on this invisible killer.
You had many exercises to deal with other types of viruses. Of course, yes, this is a novel virus, so you didn't know everything about it. But the approach to it would have been similar to other pandemics. But the problem was that you were ill-prepared. Why were you ill-prepared? Did you not have the resources? No, you didn't want to have the resources. You didn't invest in PPE, in the resources necessary to deal with any type of pandemic.
And we will pick it up where it strikes, because our new system will be able in time to detect local flare-ups in your area, as well as giving us a national picture. And yet, when I look at where we are tonight, we have the R below 1, between 0.5 and 0.9, but potentially only just below 1. And though we have made progress in satisfying at least some of the conditions I have given, we have by no means fulfilled all of them. And so, no, this is not the time simply to end the lockdown this week. Instead, we're taking the first careful steps to modify our measures. And the first step is a change of emphasis that we hope that people will act on this week. We said that you should work from home if you can, and only go to work if you must. We now need to stress that anyone who can't work from home, for instance, those in construction or manufacturing, should be actively encouraged to go to work, and we want it to be safe for you to get to work. So you should avoid public transport if at all possible, because we must and will maintain social distancing. And
I agree with him, and he's correct here. If you are sending people back into work, they need to go by car or by bicycle or on foot alone. But I would still emphasize the need for mask wearing or gloves wearing. I don't think it's a huge cost to ask people. Now, I would like to know why the UK government has decided not to encourage this. while other countries have encouraged it.
Capacity will therefore be limited. So, work from home if you can, but you should go to work if you can't work from home. And to ensure you're safe at work, we've been working to establish new guidance for employers to make workplaces COVID secure. And when you do go to work, if possible, do so by car, or even better, by walking or bicycle. But just as with workplaces, public transport operators...
The problem with the workplaces is that many workplaces haven't received information about how to make their premises, their work sites, COVID safe. They are asking the government for strict, clear rules that they can implement in their workplaces. And I understand it's difficult to do this because every workplace is different. But they need to provide information to the businesses before they encourage people to go back to work.
Will also be following COVID secure standards. And from this Wednesday, we want to encourage people to take more and even unlimited amounts of outdoor exercise. You can sit in the sun in your local park, you can drive to other destinations, you can even play sports, only with members of your own household. You must obey the rules on social distancing.
And I welcome that. I think this is a good approach. You allow people to get back out into public places without the limits that were in place before, because they've seen how the limits don't really work, because a lot of people are not not doing well under the lockdown. A lot of people are also worried about lockdown fatigue taking over. And if you have a situation like that where people are closed in their homes for a long period of time, they will rebel. They will break the door down and go out and say to hell with the consequences. But I think a system where you enforce or encourage at least mask wearing would help a lot, because I've seen numerous videos of people walking around not wearing masks. And you can find numerous reports and papers on how easy it is to spread the virus by just speaking. I'm not talking about rigorous exercise. I'm just talking about breathing or speaking can help the spread of the virus. So a mask would limit that. I'm not saying the mask would be a silver bullet, but it would help limit the spread of the virus. And the cost for the government of asking people to do this would be very limited, I think.
To enforce those rules, we will increase the fines for the small minority who break them. And so every day, with ever-increasing data, we will be monitoring the R and the number of new infections and the progress we are making. And if we as a nation begin to fulfill the conditions I have set out, then in the next few weeks and months, we may be able to go further. In step 2, at the earliest by June the 1st, after half-term, we believe we may be in a position to begin the phased reopening of shops and to get primary pupils back into schools, in stages beginning with reception, year 1 and year 6.
Now, I have a problem with this. I don't think it's a good idea to reopen schools. I think it would make more sense to keep schools closed until September and then reopen them, perhaps even in a phased way in September. I don't understand the push to get young kids back into school, because the problem is you're going to have the parents take them to the schools. You're going to have to organize public transportation for these kids on buses to take them to schools. So while the number of kids will be limited, I think it's still too early, and I don't see the merit in doing this. But I'd like to know if someone in the comment section disagrees with me and sees merit in it. I'd like to know why.
Our ambition is that secondary pupils facing exams next year will get at least some time with their teachers before the holidays, and will shortly be setting out detailed guidance on how to make it work in schools and shops and on transport. And step 3, at the earliest by July and subject to all these conditions and further scientific advice, if and only if the numbers support it, we will hope to reopen at least some of the hospitality industry and other public places.
I wish he would stop saying according to the science, because the science will say you shouldn't open these at all. That's what the scientists would be saying. So you're not really following the science. You're adapting the science. They would say you shouldn't open any of them. And your response would be, well, we want to open some of them. So how can we adapt the science to opening these? It's not following the science. It's leading the science or adapting the science.
Provided they're safe and enforce social distancing. Throughout this period of the next 2 months, we will be driven not by mere hope or economic necessity. We're going to be driven by the science, the data, and public health.
You're not. Just be honest about it. You're not following the science. The science would tell you you should have sufficient PPE. You didn't have sufficient PPE. The science said you should lock down immediately. You didn't lock down immediately. The science said you should encourage mask wearing. You're not doing that. So don't say that you're following the science. I understand it's a slogan that wins support, but you're not following the science. You're leading the science. You're using the science. You're cherry picking the science that suits what you want to do. You're compromising.
And I must stress again that all of this is conditional. It all depends on a series of big ifs. It depends on all of us, the entire country, to follow the advice, to observe social distancing, and to keep that R down. And to prevent reinfection from abroad, I'm serving notice that it will soon be the time, with transmission significantly lower, to impose quarantine on people coming into this country by air.
And this is the most ridiculous thing ever. This is the most ridiculous because the numbers are declining. Now we're going to impose a quarantine. It's completely reverse of what should be the case. The quarantine should be released, should be opened up when the numbers are sufficiently down. Not the numbers are sufficiently down, now we'll impose a quarantine. It makes complete zero sense. You should have imposed a quarantine earlier. I think every country should be imposing a quarantine as soon as possible. But you can't say the numbers have declined, now we're going to impose a quarantine. It doesn't make any sense. And also the problem is the quarantine is not a complete quarantine. For example, the Republic of Ireland is not included in the quarantine. The Channel Islands and the Isle of Man are not included. Now, the numbers of people coming from the Isle of Man and the Channel Islands are very small, so it's not a big issue regarding a quarantine for those numbers. But the Republic of Ireland, there are a lot of people moving back and forth between that country and the UK. So it doesn't make sense to exempt the Republic of Ireland. And before I started this video, I saw in the news that France is also going to be excluded from the quarantine. So what's the point in having a quarantine if you're going to exclude certain numbers of people? And what's the point in imposing a quarantine when the numbers are declining? It's like saying I'm going to call the fire brigade when the fire has almost gone out. No, you call the fire brigade when the fire has started, not when it's almost quenched itself. It doesn't make any sense to me, but I'm not following the science.
And it's because of your efforts to get the R down and the number of infections down here that this measure will now be effective. And of course, we will be monitoring our progress locally, regionally, and nationally. And if there are outbreaks, if there are problems, we will not hesitate to put on the brakes. We've been through the initial peak. but it's coming down the mountain that is often more dangerous. We have a route and we have a plan. And everyone in government has the all-consuming pressure and challenge to save lives, restore livelihoods, and gradually restore the freedoms that we need.
Well, some people, not everyone.
But in the end, this is a plan that everyone must make work. And when I look at what you've done already, the patience and common sense you've shown, the fortitude of the elderly, whose isolation we all want to end as fast as we can, the incredible bravery and hard work of our NHS staff, our care workers, the devotion and self-sacrifice of all those in every walk of life who are helping us to beat this disease: police, bus drivers, train drivers, pharmacists, supermarket workers, road hauliers, bin collectors, cleaners, security guards, postal workers, our teachers, and 1,000 more. The scientists who are working round the clock to find a vaccine. When I think of the millions of everyday acts of kindness and thoughtfulness.
I'm sorry, but I really wish the Tories had cared even half as much as this before this outbreak for frontline staff, for NHS workers, for cleaners, for factory workers, for the police, for bin collectors, for all the people that Boris Johnson has mentioned. I wish they cared half as much as they're claiming to care now. Because until now, those people were demonized by the Conservative Party and demonized by their friends in the media.
That are being performed across this country and that have helped to get us through this first phase. I know that we can use this plan to get us through the next. And if we can't do it by those dates, and if the alert level won't allow it, we will simply wait and go on until we've got it right. We will come back from this devilish illness. We will come back to health and robust health. And though the UK will be changed by this experience, I believe we can be stronger and better than ever before, more resilient, more innovative, more economically dynamic, but also more generous and more sharing. But for now, we must stay alert, control the virus, and save lives. Thank you very much.
And that's the end of that. I really hope, I truly hope, and I'm saying this because I truly care about the people of the UK, I really hope that Boris succeeds here. I really hope that this plan that he's putting in place reduces the reproduction rate below 1 and below 0.5. I hope he's successful. I hope the mistakes that were made up until now are learned, they're learned from, and new measures are put in place so that this doesn't happen again. I really hope that after this, the people that Boris Johnson has mentioned are truly considered in society as important. That this is not just some fleeting love affair with these frontline staff, with these essential workers, but that they are respected, that they receive the respect that they deserve after this has passed. That the Conservative Party care about these people, decide we have made mistakes in the past regarding these people and we have turned over a new leaf. I know some people probably are laughing at me as I'm saying that, but I hope I'm wrong. I really do. I really hope that what I've said about Boris Johnson in the past, what I've said about the Conservative Party, even in this video, I hope I'm wrong. I hope that he succeeds. I hope that the numbers decline, that people's lives are saved. But I also hope that this is a new era, that the people who were downtrodden, the people who were ignored by the state, ignored by the government, are no longer ignored, and that they are given the respect that they deserve. Let me know in the comments, guys. As I said at the beginning, if you'd like to watch the video without my comments, I'll post a link in the description. Thanks. why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun. If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.